Good morning, everyone. My name is Ryan. I'm part of the Best Health team here at Baptist. In my current role, I'm a well-being specialist. Been with the Best Health team for about 6 years now. Previously, I've earned my master's degree in exercise support science from the University of Memphis. Just a little bit about the Best Health program. We're an employee well-being program trying to improve the health and wellness of the Baptist team members. With the program, we ask all the Baptist team members to complete an annual wellness visit with their primary care physician. We also provide a bunch of health education opportunities to the Baptist team members. Some of the education we provide, we include things such as health management classes, stress management or mental health classes. We offer tobacco cessation classes, hypertension classes. We also offer some opportunities to speak with a well-being specialist to get a personalized exercise program as well. So lots of opportunities for health education, trying to improve the health and wellness of our Baptist team members. Today, you're going to spend some time with everyone talking about the health-related components of fitness. So today we'll talk about the cardiovascular endurance and what tests we can use there. Then focus on muscular endurance, muscular strength, flexibility, and body composition. Kind of talk about a few different tests in each component. What are some of the pros and cons? What might be the most appropriate test to use? So starting off with cardiovascular endurance, right? Cardiovascular endurance just refers to the ability of our bodies, of our heart, lungs, blood vessels to deliver oxygen to the working muscles, to deliver oxygen and nutrients to the working muscles during sustained physical activity. Two of the most widely used tests, we can include the 1.5 run walk test for time. You guys can see the equation here on the presentation, so we can estimate our VO2 max with a 1.5 mile run or walk test, all about how quickly you can run or walk 1.5 miles. We can plug in that time into our equation here and get an estimation of our VO2 max. I guess just an estimation. If we wanted to truly measure VO2 max, we'd have to measure that on a metabolic cart. A lot more equipment involved with that. We also potentially use the Cooper 12-minute test. But there's some other tests as well that might be maybe a little bit easier for some folks, such as the 6-minute walk test. I've used the 6-minute walk test when I was working in a pediatric weight management clinic at Le Bonheur. We use our 6-minute walk test to kind of measure cardiovascular endurance. With a 6-minute walk test, basically there's the total distance covered at a self-selected pace over 6 minutes. So you record the distance covered, other things such as heart rate, perceived exertion as well. Might be more appropriate for those, especially if they have any pulmonary disorders. Moving on to muscular endurance. Right, muscular endurance just provides some insights to the body's ability to perform some daily tasks that require sustained muscle effort, right? So sustained over a period of time. The one you can see on the screen here, we could focus on like a push-up test. We can do the maximum number of push-ups without rest. Some other tests, we don't have to just do push-ups or just use push-ups, right? That's going to be like an upper body muscular endurance test. We also do a sit-up or curl-up test. That'd be more of our muscular endurance of our core. If we wanted to look at the lower body, we could do a sit to stand test, potentially for like 30 seconds, for example. We can give us a good indication of both leg strength and endurance. How many times can we rise from a seated position in 30 seconds? Really give us a good indication of our lower body muscular endurance. Similar to muscular endurance, we can also measure muscular strength. One of the easiest muscular strength tests would be the hand dynamometer. You can see pictured here. So would probably be the easiest muscular strength to complete. Also potentially the least injury-prone test. It gives us a good indicator of our overall strength. Some other field tests we can include like a 1 rep max bench press or a 1 rep max squat. Those are going to be much more appropriate for those that are already familiar with a bench press, already familiar with a squat. We would not want to take someone that has not lifted before and perform the 1 rep max on a bench or a squat. Obviously, with those, it takes much more time to warm up to complete those tests, and obviously a lot more risk for injury when we're completing a 1 rep max test, especially when we're comparing it to a hand grip strength test. So again, we have to really think about which one of these tests are the most appropriate for our populations. Again, we have to have the equipment, the space, the time to perform a 1 rep max test on the bench or with a squat. We also potentially do a max repetition test. How many bench, sticking with a specific weight, perform a repetition maximum with a bench press or leg press or squat as well. Muscular strength, again, just refers to the ability of a muscle or muscle group to exert maximal force in a single effort. Moving on to flexibility. Right, flexibility, want to measure this, right? What kind of mobility and stability do we have? Super important for us as we age to maintain our mobility and flexibility. While a sit and reach might not be included in the ACSM guidelines anymore, still a common physical assessment used to measure flexibility, really focusing on the hamstrings and the low back. There's an easy one to potentially use to measure our lower body flexibility. Again, in my time at the Pediatric Weight Management Clinic of Bonner, we did use a sit and reach test. Just mention that, again, this could be quickly used. You guys can see here, right? We can also measure the range of motion of all of our different joints. We're going to use a goniometer to measure range of motion at specific joints. That'd be much more appropriate for a physical therapist to measure joint range of motion. Right? They're going to measure that to see, are we making improvements with some physical therapy or rehab? Right. Again, using the sit and reach test could be easy to use. You could potentially do that with no equipment. Just anecdotally, I've seen some younger folks not be able to do the sit and reach test at all. They weren't even able to sit flat on the floor with their legs straight without their knees bent. So for the sit and reach test, it'd be much easier to potentially show this than describe this. Right, again, you're going to sit flat with your bottom on the floor, legs straight out in front of you, knees not bent. Right now, you're going to reach as far forward with your hands as you can possible. I've seen some younger individuals at the Pediatric Weight Management not even be able to sit with their legs straight. They could only sit on the floor with their legs bent. Also, I've seen some older individuals not necessarily even trying to do the sit and reach test, but just taking off their shoes. They've struggled to even reach to their feet to take off their shoes, to take off their socks. So certainly something we want to think about at all ages. Do we have appropriate mobility, stability, and flexibility? If not, maybe that's something we want to work on. Some other great ways to measure mobility or stability would be the functional movement screen. There's 7 tests with a functional movement screen. Again, would take some time to go through that assessment, a lot longer than just a single sit and reach test. Lastly, focusing on body composition. You guys have already kind of mentioned some of the ways to measure body composition throughout this lecture. But starting off with probably the gold standard would be the DEXA scan. The DEXA machines are very expensive, but give us some great insights on our body composition. Not only does it give us fat mass and lean mass, but it also gives us bone mineral density. So pros, gives us lots of insight into our body composition. The con would be you do get some radiation from the DEXA and the cost of the machine. Again, DEXA kind of the gold standard for body composition. We also do hydrostatic weighing. This one's, I would say, is pretty tough because your participant would need to be comfortable in the water. You measure underwater weight. So the participant would have to be comfortable with getting in the water, submerging their whole body underwater, exhaling all their breath underwater and maintaining that position while you get a good measurement. So it can be difficult. You do need a large space to house. I would say it's about the size of a hot tub. So not the easiest thing to do, and you do have your participant has to be comfortable in the water and holding their breath underwater. So we're actually coming to do the in-body bioelectrical impedance analysis test with you guys here in a couple weeks. Love to see you guys. So that's what's pictured here on the slide. Gentleman is standing on an in-body test here. So there's lots of different types of bioelectrical impedance analysis tests. It sends a low level electrical signal between electrodes. So there are some that are just hand to hand, some that are just foot to foot. This gentleman here has both hand to hand, foot to foot, and also from feet to our hands as well. Again, very quick, very easy, potentially not as accurate as the hydrostatic weighing or DEXA, but in terms of ease, much easier than potentially submerging someone in a tub of water, basically, or a body of water. We also do the air displacement plethysmography. We have the BOD pod. I've used this before as well. Again, maybe a little more expensive than I guess the in-body is expensive as well. Depending on which type of in-body or bioelectrical impedance analysis machine you use. I bought a cheap one off of Amazon for, relatively cheap. Another one we have is not cheap, and I've seen some that even are able to measure visceral fat that are even more expensive than the ones we have. So again, kind of range of expenses there. We also, moving on to number 5, focusing on skin fold measurements. This one might be, I guess, one of the low-tech options. So don't really need technology, just need some skin calipers. Do have to be well-trained and experienced, and we use the same technician each time you're trying to repeat the skin fold measurements. This one's a little bit uncomfortable for me personally because you're actually grabbing someone's skin and grabbing and pinching their fat and measuring how thick the pinch or the skin fold that you're grabbing. So a little bit uncomfortable to me to perform this test, but again, can be maybe more of a low-tech option, much cheaper than the DEXA, for example. But you do have to be very accurate with focusing the same location each time you're measuring and grabbing the same amount of skin you're measuring. Otherwise, you're going to have some error in your measurements and error in your results. I believe you guys already spoke about the BMI and some limitations there. We can also use potentially waist to height ratio, maybe in place of BMI. BMI is just relationship of our height and our weight. Waist to height ratio might be a little bit better of an indicator of health risk than BMI. Might be fun to kind of play around with as well. Again, we're coming to the university to perform our in-body test and body composition testing on April 27th from 8 to 11. We'd love to see you guys there. You do have to stand on there barefoot. There's some other test prep instructions as well. We'd love to see you guys. Again, it's a very quick test. You have to stand on the scale barefoot. So be ready for that. But you can get some good insights. You can actually look at some percent body fat, skeletal muscle mass, and it can even break down lean mass by segment. And it's a great tool to measure body composition quickly. Lastly, just want to talk about measuring progress. I believe you guys are supposed to create a wellness plan and supposed to measure progress over time. So again, really think about what tests or what you are looking to measure, what aspect of fitness you're looking to work on is really going to determine which tests we're choosing here. For example, if we're looking for endurance, I've used the Strava app myself. There's other apps like the Nike Run Club, etc. They're great to kind of measure progress, set goals, provide some motivation. I have some other examples here on the screen. This one's from the NIH. This would be more for someone maybe that's not as active. Definitely not maybe someone that's not an athlete. But they do have an endurance test, upper body strength test, lower body strength test, balance test, and a flexibility test. There's other ways to measure and track our progress as well. We could just simply keep a fitness journal, especially for lifting weights, for example. We can write in our notebook, For example, from working on lower body strength, focusing on squats, starting today, how many reps can I do at a specific weight? We can retest that again a month later, et cetera, et cetera. And then at 6 months, have I made progress? Am I able to lift more weight, or am I able to complete more reps? Be an easy way to track progress. That's all I have for you guys today. Hopefully you guys enjoyed my talk. If you guys have any questions, feel free to reach out to me, and look forward to seeing you guys for the in-body testing.